Our next pitcher is José Matta of Clinical Fitness.
All right, good morning, everyone. My name's José Matta, or Dr. José Matta. I'm a doctor of physical therapy, and thank you for giving me the time to share my mission and my business with you, and that's clinical fitness. All right, so the problem I've come across as a physical therapist is that we're very reactionary in how we treat our patients. Why do we wait for people to get hurt? And then I tell them, well, maybe you shouldn't have been doing these for the last, weeks, months, or even years. And then after I fix a patient, where do I send them to continue on the progress that they've made in physical therapy? I put fix in quotations because keep in mind that physical therapy isn't designed to get people to 100%. We're designed to get people independent, and then they're supposed to continue their progress on their own. The term the insurances like to use is medical necessity. Once treatment is no longer medically necessary, we're supposed to discharge the patient. All right. And the overarching problem that I've found is that fitness education is severely lacking in today's society. All right. I am astounded almost every day in how little people know about how their own bodies work. And these aren't uneducated people. These are very educated, very wealthy, very successful people that I work with that just have no idea of the biomechanics and how your joints work and all that kind of stuff. So I just think that's a huge problem, and especially since we're becoming more sedentary as a society, knowing how to work your body and supplement that activity level is just becoming more and more important. I like to tell all my patients, we went from hunting down our food to we don't even have to get up and turn the lights on anymore, right? We just tell Alexa to do it. So, and then what should be the solution is the fitness industry. But unfortunately, it's just become overly complicated, very expensive, dangerous, and just ineffective. All right. So you can go to a big box gym, you go in there by yourself, especially people who don't have an athletic background, they don't know what they're doing. That can lead to injury, of course. And then they could get a personal trainer, but unfortunately the qualifications for a personal trainer aren't exactly very high. You just have to be 18 years of age or older, and it's a 6-month online certification. So I don't think that exactly makes you an expert to tell people how they should be working out. And then if you do get a personal trainer, you can see there it's about $60 to $150 a person. A session. So you can see if you're going 3 times a week, which I think is the minimal amount that most people should go, that's a good amount of chunk of money, and most people cannot afford that. You can see there just a little stat that almost 500,000 people in 2019 went to the ER from exercise-related incidents. All right, and that went to the ER, not just counting all the people that just injured themselves. And then what ends up happening is right there, that bottom line, the CDC estimates that less than a quarter of all adults attain the minimum exercise recommendations. And those really are minimum recommendations. I think they should be much higher. All right, before I go any further, I do want to introduce myself so you can kind of see where I'm coming from. I am a graduate of the U.S. Naval Academy where I played baseball, but I've also played on competitive sports, everything from ultimate frisbee to rugby and football. I did 8 years active duty in the military, and I was discharged as lieutenant commander. I went straight to University of Miami's Doctorate of Physical Therapy program, actually enrolled while I was still on terminal leave. And then for the last 7 years, I've been practicing mainly in the orthopedic setting. I am an ACSM certified personal trainer. I like to put that up there so I'm allowed to talk all the trash I want about personal trainers. And then why me? So I really feel that with my experience, I know what improper training can do to people. I felt it myself in sports, in the military, and in day-to-day life that I've seen in my practice. All right, so what is the solution? That is clinical fitness. It's a facility designed for safety, education, and promotion of long-term habits. All right, everybody that goes in gets a full upper and lower body screening by a physical therapist, simplified exercise programs, okay? Fitness has just become so complicated. They have people doing things upside down, throwing things. I mean, it's just flipping tires. Like, we don't need to do all that. All that does is just increase the probability of injury. As soon as somebody gets injured, there goes all the progress they've made. Affordable one-on-one training. If people do need that one-on-one help, I want to provide it at an affordable price that it's going to be more accessible to people. And with the final goal of getting independence-based workouts. So people coming in, using the gym, with physical therapists walking around constantly fixing form, educating, answering questions, basically how gyms should be ran. All right. Because that's my goal, is to get people independent. You can't become good at something if you're relying on somebody else for it. So I want to get people that confidence to become independent. All right, and the specifics, I call it the Matta method. Basically just fundamentals of exercise, concentrating on posture, concentrating on form, motor control, joint protection, doing things that are actually good for your body, not that are actually going to tear you up in the long run. 50 to 75 exercises split up into skill levels, hand-picked exercise equipment for ease of use. I want a software that I track patients' progress, and that as soon as somebody checks in on a tablet that the clinicians have, it shows a little summary of them, their medical history, what their goals are, that kind of stuff. So when somebody walks in, it's, how you doing, Mr. So-and-so? How's that low back feeling today? Is there any questions I could ask you? That's a big difference from the kid at the front desk that doesn't even look up at you from his cell phone. And then a boutique fitness environment. So I do want these to be smaller in space, about 2,500 to 3,000 square feet, because I do want people to feel like they have that supervision. If it's this big gym where you can't even see the other people in there, you kind of lose that effect. And then I want to minimize it to about 8 to 12 clients in there at a time, so you don't get that feeling that people are on top of you, like I'm sure you guys have seen at some of these LA Fitness, Planet Fitness type places. And along with that boutique, it's basically concierge physical therapy. They have a lot of these concierge doctors now. Well, that's basically what it is. You have a pain, you go into the gym, you got a physical therapist right now, we can address it right then and there before the issue becomes worse. My target market, initially, it's going to be probably the 35 and older, basically all those people that are now starting to get those aches and pains that don't seem to be going away. And then post-recovery, like I was talking about, after they finish physical therapy. Longer term, I want all ages in there. I would love to have everybody from 12 years old to 90 years old. I think starting those good habits early is huge. I think about the things that I was doing when I was in high school, bouncing weight off my chest, doing all these things wrong. It was my JROTC teacher, my algebra teacher, teaching me how to do this stuff. So, but I would love to get kids in there, teaching them how to do it right, and then eventually target people with disabilities, Parkinson's, MS, people who need that help. They're the ones that need to move, but unfortunately, there's nothing in place to allow them to do that. Once the brand is established, I do want to branch out to police, fire department, schools, corporations, to give seminars and kind of just educate people on proper physical fitness. I have actually already even started that. I did a seminar for a corporate law firm down in Miami, and then I'm also working with an independent living facility where I go in there for a couple hours multiple times a day, just doing exactly what my plan is, walking around, educating, and I'm getting nothing but great feedback from it. And the opportunity's there. It's a $41 billion industry. That was before COVID. It took a little hit after COVID, but it's coming back really fast. And I'm really trying to hit that untapped market. The people who actually have never gone to the gym because they're scared of it. Perfect example, my girlfriend's parents retired about 5 years ago. They're starting to put on weight. Their activity levels have gone down. They're getting neck pain, knee pain, all this stuff. So they're exactly the type of person. We've been hounding on them to go to the gym, but they're just scared to go because they don't know what they're doing. So they're exactly the type of person that would be coming in here. They would feel good. I would market to doctors, so the doctors would refer them in. And just make sure that they feel safe in there doing what's good for their bodies. And the competition. So the competition is basically the gyms, the Orange Series, the CrossFits, but they just don't have what I'll be providing. They don't have the expertise. A lot of these places are all based on performance, sports performance, all that kind of stuff. That's not what most people are trying to do, all right? Most people are just trying to be able to power wash without hurting their backs, all right? So build a little core strength. That's all you really need. And do it in a safe way so you're not hurting your self-worth. Not trying to steal your business, though. So yes, that education, that medical guidance, licensed physical therapist assistants walking around, safety at the forefront, and that boutique fitness environment. All right, here's just a little chart here with all the comparisons of the other places. You can see their clinical fitness checks all the boxes. And the next slide here, we're going to talk about how I do want to keep it affordable. So, but first of all, the marketing, I'm going to do word of mouth for the most part at first. I've already started doing this kind of just, one-on-one with clients. The only marketing I've done is I made a few business cards. And within a month, my schedule was completely full. I'm working 6 days a week, 7 in the morning to about 7 o'clock at night. So the need is out there, and people really love the service. Then I'll do Facebook groups. This is the big one here: marketing the physician's office and physical therapy clinics. So just going around to the clinics and just telling them exactly what I have my problem. Hey, you got somebody that they just need to continue working out and they're scared to do it, send them to me. I'll make sure they get on the right path. And then I'll definitely network with the Pelota yoga studios, all those, basically because yoga, Pilates, CrossFit, all that, those are all activities, all right? Unfortunately, people think that they can do these activities and get in shape. And that's really the wrong way of thinking. That's why people are hurting themselves all the time doing that. You need to get in shape in order to be able to do those activities. And then the price. So like I said, I do want to keep it reasonable, about $150 a month. I am hoping to have insurance offset some of that. The one-on-one training, you can see there, I want to keep it to about $40 a session. Again, really trying to push people off of that. And then eventually I do want to have physical therapy services, kind of a la carte physical therapy. Your neck hurts, you're just got over rotator cuff surgery, you need some range of motion. We could provide those services as well. So this is my current status. Like I said, just for the last 3 months, I've been doing full-time with clinical fitness. Before that, I was managing 3 physical therapy clinics for an orthopedic group. Within the last 3 months, I've been able to already generate over $40,000 in revenue, and that is just me, myself, and I. And then, so my next future milestone, the big thing is I need to attain a physical location. I want to create that environment, and it's hard for me. Right now, I'm doing it also in 2 local gyms, but it's hard for me to create that environment when everybody around me is doing things wrong. So I need that specific location. $10,000 would go really good toward that. And then I need to get some equipment, hire a few employees, get my brand and marketing strategy, and then eventually I want to expand to multiple locations. I would love to be the gold star in educational fitness. Financing, about $250,000. I'm not even sure I need all that. I think with the market research I've done, within about 6 months, I'm probably going to have enough clientele to kind of hold me going. And then here's my projections. I was very, very modest with these numbers. I kind of took the low end on all of them. And I do estimate that each location would be about $100,000 a year profit. So in conclusion, clinical fitness will fill in that much needed education and guidance that we need in today's society, simplifies fitness recommendations, and then I'm going to fill in that gap between the fitness industry and the medical industry. Thank you.
No. Well, very, very innovative, very unique. So, what are the major risks? And I think so. Did I miss it, or what are the major risks about this?
Yeah. I mean, I honestly don't see this failing. I mean, just all the feedback I've gotten is good. The one major risk would be maybe the price point, especially when these other gyms are charging $10 a month. But I mean, you're getting $10 a month service, and I hear it all the time at the Planet Fitness and stuff. They're like, oh, I try to ask for help and nobody's there to help me, or it's just somebody that's uneducated. It's just an undergrad kid that's helping people out. So that would be my biggest fear is just the price point. But other than that, I don't really see any risk.
Yeah, thank you. And I will let the other people to ask. But for the marketing, I think so. Only a suggestion. Having seminars in the hospitals might be also a good idea.
Absolutely, yeah. Seminars in the hospitals. We're down in West Palm Beach. There's country clubs all over the place. Having those country clubs will bring in doctors. They'll having seminars in there to try to market for those populations as well.
Yeah. So I guess I think I understand where you're headed towards this, but it sounds like you're a hybrid between like physical therapy and gym.
Exactly.
Right.
Yep.
Okay. So then how, I guess from my perspective, you're starting to now compete directly with physical therapy and gyms. Mm-hmm. So besides the fact that like there's clearly education and stuff like that, like what are you planning on doing to distinguish, to essentially be a vastly different option between the two of those?
Yeah.
That you could actually, I guess, quantify that price point.
Yeah.
Right.
So basically, I mean, if any of you guys have ever been to physical therapy, most physical therapy places aren't well equipped. They don't have like a full gym, anything like that. It's some bands, that kind of stuff, And then most gyms don't have the expertise. So I'm taking the best of both, putting them together. So like I said, you can go to a Planet Fitness, you can have people on top of you, you can wait for equipment, you can have no idea what you're doing, maybe, hurting yourself worse, or you can come to this place. You have, I'm going to control the flow in there. I'm also going to have people walking around kind of, regulating, the stuff people do. So, you don't have all the shenanigans going on at the other gyms, so it's just going to be a much better flow, more efficient. And then, it's actually going to make the workout experience better for the person where they don't want to just walk out the second they get in the door.
Thank you.
I just have one quick question about the boutique service. So 12 members per day or at one time?
So I think I would break it up into like 2-hour sessions, and it'd be 12 members in there at a time. Yeah.
So the membership is 150 plus. What's the maximum amount of membership for that 3,000 square foot facility?
So probably about 100 to 125 members. Yeah. Because it's going to depend on, if people are coming in 2 times a week, 3 times a week, 4, whatever it is, how many. But I figure we'll just have some sort of calendar where people will be able to kind of block off times. And then as long as I keep it around that 10 person, and then if I need more, obviously I would just have to hire some more physical therapists. But at the same time, I don't want it to be a place where people are having to wait on equipment and that kind of stuff. But I think with the numbers I worked out, if I think I did 1.5 blocks, so there'd be 8 1.5 blocks of people there supervising, it would work out to where I could have 125 people that were all coming in 3 times a week.
And are you factoring traditional work hours? So 35 plus? They're working 9 to 5?
Yeah. Well, that would be, I would probably have to surge like right after work, that type of stuff. But I think, especially down in South Florida, I think a lot of it is going to be older adults retired already. So, they'll be able to come. And then obviously, when I'm doing the evaluation, I'll have to kind of try to manage that, get them to come in on the less busier times.
Okay.
That's it? All right. Thank you very much.
That's fast.